your organization name in the chat. And I think we'll go ahead and get started. For those just joining, welcome to the San Diego Path CPI. Happy Friday. Happy long weekend. I have a couple of meeting logistics that we'll go through. Roll call again, entering your name and your organization name in the chat. If you can, update your Zoom so it at least has your name, preferably your name and your organization name. I'm guilty of not having it myself this month because I lost my little app add-on. So that said, we do record the sessions and then we post the recording on our website. We also share it in our Slack channel, and we'll send out an email along with a survey after our session today. Love to see your faces. Strongly encouraged, not required, but it is nice to start to see some familiar faces each month as we continue to meet. All right, with that, we'll go ahead and get started. Okay, we'll do a quick instant replay and get into some community announcements. We'll then dig into a little bit of funding updates. I know we shared some funding updates in our coffee chats this past month, and via the Slack channel, we shared from Lisa the IPP updates. We'll spend a little bit of time with those again today. And then we'll get started in our activity, which will be a continuation of our last month's activity with some hopeful next steps. All right. Not a whole lot to look back on from last month, other than putting together that Slack channel and having those funding webinars. If there's other aspects of funding that you all are interested in us bringing to you in the Path CPI, please let us know, and we'll do our best to accommodate that. I know we're continuing to participate in meetings that are happening around the community. If there's something that you'd like us to participate in, even if it's just to be a listener and learn, please let us know. We have had the opportunity to participate in the Healthy San Diego Joint Consumer and Professional Advisory Committee, so thanks to the group for that. Our managed care meetings and some one-on-ones, in addition to some conversations and participation in work groups. So continue to let us know if there's things that we're missing out on. The same is true for participants. If you feel like there's people that aren't here, they're not at the table, they're partners that you work with, referral partners, etc., let us know. We're happy to reach out and tell them a little bit more about the Path CPI and encourage them to participate in the future. Okay, so next slide, please. Sort of why are we here? So just kind of as a reminder about CalAIM, and this is something that we'll continue to provide every month. But really starting at the beginning of the year, trying to come together and collaborate on an aim, sort of a purpose. What do we want to do by the end of this engagement? You know, can we do it and how could we measure it? And then from our aim statement, our overall goal, really trying to dig deeper into things that might help drive us to that goal, and then different activities that we could test throughout the year to continue to get us towards that aim statement. So a lot of the work that we've been doing in some of our breakout sessions and activities that we've participated in, we're doing so with that in mind. Okay, so without further ado, we'll get into community announcements so that we can get into our activity today. And we'll start with Lynn. Lynn, are you on the line?
Yes, I am here. Thank you.
Thanks,
All
Lynn.
right, so I will give updates on behalf of County of San Diego, our SDAIM team. So bear with me, they're kind of lengthy today, but I think they're exciting. So we're happy to announce that on Tuesday, the 23rd, we presented to our County Board of Supervisors a board letter on CalAIM and our SDAIM roadmap. And the board was very supportive of CalAIM implementation and the SDAIM roadmap. And so our next steps is to create an action plan that will support the county's SDAIM roadmap. And then next update is there's the Healthy San Diego Child and Youth Ad Hoc Work Group. This was launched in April. There's been 3 meetings to date, and the group is meeting bi-monthly. The co-chairs are Kim Fritz and Skylar with Blue Shield Promise, and then Heather Summers with the County of San Diego. It formed in April, and it's going to continue through July. As of now, that's what the goal will be, to go through July, and that's when the Child and Youth Population of Focus goes live. The group has been focused on developing population of focus estimates, starting with 2 subsets of focus, which is CCS, California Children's Services, and foster children. And the group's working on creating a dashboard with some data that will inform the number of potential children and youth that are eligible, that are within the population of focus. There's 6 focus areas that they're discussing or will be discussing. The first is data by category to quantify and estimate the number of children and youth that are eligible. Second is discuss specific needs of the population, such as health and social. Third is population subset, which is out of the existing children and youth providers, are there sufficient number of providers to meet the estimated population of focus? And then the fourth is communication with the medical home. Fifth area of topic is ECM providers for children and youth population must have demonstrated experience with children and youth, and then discussing what additional considerations are needed. How will fidelity and experience of providers be taken into consideration? And then the 6th is approvals and referrals of transition of care. So discussing authorization, provider assignment, enrollment, transition of care as children and youth step down, and how to consider a holistic approach. And then the next update is I want to just go over the Healthy San Diego Justice Involved Work Group. So we've had 2 meetings to date. Our last meeting was actually on Wednesday. The goal will be to meet monthly, and we're looking at the 4th Wednesday of the month from 1 to 2 p.m. to meet. The co-chairs right now are James Trout with Aetna, and then myself. We kicked off the work group in March. The focus is CalAIM Justice Involved Initiatives, which includes pre-release Medi-Cal enrollment, 90-day pre-release services, and launching ECM for individuals transitioning out of incarceration. The last meeting was really focused on funding opportunities for community providers who are interested in becoming an ECM provider for the JI population. There was an overview on path-cited opportunity. We also talked about this collaborative, the TA marketplace, and then James provided an overview on IPP funding opportunity. And then the next meeting, we're going to have a presentation on what current pre-release services look like and provide additional information on how community providers can become ECM providers. And then my last update is just an update on funding for the Justice Involved initiatives. To date, we applied for the first round of funding and the second round of funding, which supports the pre-release Medi-Cal enrollment process. And that's for individuals who are in local jails and youth detention and reentry facilities. And the process is to ensure anyone who's in a correctional agency has the opportunity to enroll in CalAIM before they return to the community. And so the first 2 funding opportunities are to support that process. We are awarded the first one. The county is waiting to hear on the second. And it was the Sheriff's Department, Probation Department, and then HHSA who applied, and we should hear any day on our award. And then the DHCS just announced the Path JI round 3 application, and that's due July 31st. And the county plans to apply for that. So those are the updates from the county. Thank you. And if anyone has any questions, please let me know.
Thank you so much, Lynn. Any questions for Lynn? If something comes up after the fact, let us know and we'll make sure, if you don't already have Lynn's contact information, we can help get you over to Lynn to talk through some of the questions you might have. Lynn, if any of that information, you absolutely do. If any of that information you think might be helpful to the collaborative, you don't necessarily have to wait for this monthly meeting. Please feel free, leverage that Slack channel, even if if it's that presentation or deck and you think that folks might be interested in it. Feel free to leverage that to do some information sharing as well.
Sounds good. Thanks, Denise.
And Lynn, it looks like Glenn has a quick question.
Glenn, that's actually a great question. So Glenn is asking if the GI community supports are not rolling out until January 1st, 2024. And several months ago, we reached out to DHCS for clarification on community supports. And we were told, and I can pull the email and share it if anyone's interested, but community supports are actually not tied to ECM populations of focus. So each community support has its own eligibility criteria. And so an individual does not have to fit into a population of focus to be eligible for a community support. So if you're working with an individual who's justice impacted or just coming out of a local jail who has some housing navigation needs or housing deposits or asthma remediation or whatever that community support is, they're eligible now. All Medi-Cal, my understanding from the very clear email DHCS sent was all Medi-Cal members who are assigned a managed care plan, as long as the managed care plan provides that community support, they meet the criteria and they're authorized for it, they should be eligible. They don't have to fit into a population of focus. So no, we don't have to wait until January 2024 if someone needs a community support now. So thanks for that question.
Thanks, Lynn. Next, I'll pass things over to legal aid. Jack, I think you're on the line. I checked. I didn't see Greg, if you're on the line as well.
Yeah, I am here, and I apologize, Denise, for joining late. Have some carryover work this morning, so I apologize. Glad to be here. One of the notes I'll just add on to kind of Lynn's last comment regarding community supports. I'm really glad that distinction is out there, because I think sometimes the framing of community supports has been seen as an add-on to ECM, but it's a distinct benefit. I'll note that some of the community support benefits, individual eligibility criteria for one of the 14 specific benefits will include as an option eligibility for ECM. So if you're in ECM, you're one of those population of focus receiving ECM services, that may help you kind of qualify for specific community supports benefits, but it's in no way a requirement to generally qualify for accessing community support. So I think that's a really important distinction to drive out there. I was going today to provide 2 quick updates. One, following the last Healthy San Diego Joint Professional and Consumers meeting, there was a really great presentation by Dr. Yorman and 3 medical directors of LTC facilities, and it, I think, engendered a great discussion about some of the gaps and challenges that older adults and people with disabilities experience navigating the continuum of services under the very broad veil of the long-term services and supports through Medi-Cal. And so there was energy and interest in breaking out a sub-work group and or task force to take those conversations further and further workshop those and understand those gaps and challenges, so that we can potentially identify local solutions and steps to address and solve some of those gaps. So that first meeting of this new sub work group has been scheduled for June 2nd at 1 p.m. And there was an invite sent out. If anyone needs that invite forwarded, I certainly can forward it on to you. And I would invite anyone interested, anyone that represents any of the sectors involved in the provision of any of the long-term supports of services. Those could be community-based services, in-home personal care, IHSS. It could be associated vendors that work with populations accessing those services, and of course LTC facilities, plans, care coordination vendors, anyone involved in engaging hospitals, anyone involved in the engagement of consumers along that continuum of long-term supports and services. And so I think it's an issue that certainly I'm passionate about, and I know a number of folks in our stakeholder community are really passionate about working on. So I'm looking forward to a productive meeting and hope folks will join. So that's June 2nd at 1 p.m. The other item I was going to highlight was that we're just on the Medi-Cal eligibility side. Just wanted to flag that renewals, the renewal work continues. The counties, we've been in close communication with the county eligibility operations. It sounds like everything is going fine from their perspective at this point with the processing. I think they're processing upwards of 29,000 or so Medi-Cal renewals for the month of June. And I did want to flag that CalHERS, there was a recent CalHERS informational notice that was sent out that flagged a concern with MAGI beneficiaries that are going through renewal. There's a glitch in the system right now that may present a challenge to completing the processing of MAGI Medi-Cal beneficiaries that are undergoing renewals in June and potentially even July. And so the DHS is issuing a hold on those renewals at the moment. I just learned about this this morning, and I'm trying to sort out the details of what the implications of this. We would have the expectation that even if a renewal cannot be processed timely, that in no way disrupts Medi-Cal eligibility, that Medi-Cal eligibility would be maintained until the renewal is completed. So even if someone was scheduled to have a June renewal, if it was not completed on time due to this system challenge, that in no way would disrupt the Medi-Cal eligibility. But wanted to put out there that if anyone is in any of the sectors are seeing challenges with June renewals for MAGI beneficiaries, that we certainly would be interested in learning about those. And so just want to put that out there, but no cause for alarm at the moment, because we do not expect there to be any disruptions of eligibility for those folks while the system issue is worked out. But certainly want to look out for any folks that do pop up and say, hey, I was on MAGI Medi-Cal and now I am not, and there's no explanation why. So wanted to put that out there. I think that's it from my end. I'll take any questions or thoughts.
Thanks, Jack. It looks like there's a few that might be interested in that meeting. So however best to share that. If you'd like to, I'd be happy to add it to our follow-up email that we send out with meeting materials. So if you want to send any of that information along, we can make sure that it's disseminated, or feel free to share it through the Slack channel as well.
Okay, great. Well, I'll do both. I see just a couple here folks reaching out, but I'll also make sure you have the invite information, Denise.
Awesome. Thank you so much. And we'll pass things over to Christy. Christy, you're on the line to talk community work groups, ECM and CS provider work groups.
Hi, everybody. Thanks, Denise. We are continuing to pull together the ECM and CS provider work group. So we meet once a month, and I think we've had some really great discussions. This last month, Denise, or I think it was Danielle, actually, Danny, from Intrepid Ascent, as well as Lisa from Transform Health, were able to join the call. So I think that provided some really great perspectives and additions to the discussion we had. So this month, we spent most of our time talking about a couple things. So one is the ECMCS provider work group has come up with some challenges, implementation challenges, and we've kind of categorized those into some different categories and looking at potential solutions. And one of the things we're trying to do with those implementation challenges and solutions is try to align those with what we know are some of the other efforts that are going on. So, for example, kind of aligning and matrixing out some of those implementation challenges with what we know is the path CPI collaborative aim and what some of those topics and priorities are. So I think many of you may have been involved when we did those with this group, with the CPI collaborative, we did those small breakout sessions. So there were some topic areas identified there and some actions. And so thinking about how does that line up with some of the implementation challenges and solutions that the provider work group has come up with. And then also taking a look at the Department of Healthcare Services, what the requirements are, reporting requirements are for the managed care plans. So there's a set of measures. Some of that is IPP measures. Some of that is HIP measures, so the Housing and Homelessness Incentive Program measures, as well as the Incentive Payment Program measures. So those are all areas with pretty detailed measures that the managed care plans are reporting on. So how can we line up some of the implementation challenges and solutions that the provider work group has come up with? How do we kind of align that with what we know are those reporting requirements for the managed care plans? So we spent some time talking about that. And Karis from CIE and I are going to spend some additional time trying to kind of build out a table. We started a table that starts to align some of those things, and we'll spend some more time kind of lining that out. But we think there's some good opportunities there to align some discussions. And then second topic we talked about was all of these new capacity building opportunities and funding opportunities that are coming out. So some people have already been funded under Path Cited Round 1. And some folks are also applying for Path Cited Round 2, which is due next week. So we spent some time talking about that, what was in people's Round 1 applications that they wanted to share, and then what were people thinking about planning for their Round 2 applications. And then similar discussions around IPP Round 1 and 2. And again, it was helpful to have Danny and Lisa on that call to kind of chime in and share their perspectives, what they're seeing, what they're observing with some of these new opportunities. So that was a great discussion and opportunities for providers to share as well. And then third topic we talked about was the community support work groups. And I know I'm not gonna spend too much time on that because I know you're gonna hear from Karis around some of that, but we do have a recuperative care work group that is meeting. There's definitely been some interest from the housing trio. So thinking about the community support housing services and pulling those providers together. And then also a lot of interest around pulling together the meals providers. And so I think with those work groups really looking at referral pathways, what's working, what's not working, and how can we increase not only referrals, but utilization of all of those services. So we had a good discussion around that. And then there were some questions around the ECM CS provider directory. And I know Joanna's going to get into that a little more, so I won't go into that too much. And then we also had a discussion around, I think it comes up in a lot of our meetings, but this notion of local San Diego County data on ECM and CS services. So what do we know not only about who's providing what service? So the provider directory, I think, can help us with that. But then also starting to dig a little bit deeper into service utilization. So definitely a need for that, as we've talked about in this collaborative and in other work groups as well. I don't know that we have a lot of answers yet for that, but definitely part of the discussion. So I'll pause there and see if anybody has any questions.
Thank you so much, Christy, for sharing. Karis, first I'll say welcome back.
Thank you.
And then we'll hand the mic over to you to share some additional updates.
Awesome. Hi, everyone. For those of you who didn't know, I had a baby that's being rocked right now as we speak. So hopefully he doesn't make a cameo while we're talking. But as Christy mentioned, we have pulled together some of our recuperative care providers. So this is in collaboration with ICS, PATH, Father Joe's, HASDAC, as well as San Diego Wellness Collaborative. And through PATH Cited, we'd kind of started this prior to, we got funding through PATH Cited 1B, but our goal was really to increase access, referrals, and enrollment to recuperative care and short-term post-hospitalization, because at the time it was really hard to navigate and being able to access it. And is there a way to streamline the referral process, the intake, potentially the access, and the training to support an increase in those referrals? So we have been meeting as a group for a few months now and are really looking at kind of, can we streamline the intake and referral process? Can we create some sort of real-time bed availability to be able to see where the needs are by location? Because, it does become complicated as people are contracted with specific health plans or where they live in the region. So Glenn from PATH has stewarded kind of identifying how could we potentially look at that and how could we be, what would we be measuring as a small group to be able to view that information? And then what training and tools do the community need to be able to make those referrals as accessible, and the eligibility in those in that enrollment process improved. And so it's not just us as a group. I mean, I think we're hoping to lean in with and work with MCPs, hospitals, all of the contracted CalAIM service providers, FQHCs, to really be thinking about how do we improve that referral process and identifying people that could be qualifying for recuperative care or short-term post-hospitalization. And then I think our additional goal, as Christy also mentioned, is like, what are lessons learned, or how could this be applied to other community supports as we think about the broader needs around access and eligibility and intake and referrals? How do we just improve that process? So we're learning a lot and are just kind of getting meetings regularly on the book where I'll start to kind of identify what are the challenges. And again, we did this months and months ago, and a lot as shifting is changing. So we'll see kind of, are those the same needs we have? But we had a link before that we could probably send out again. That will be for those who would like to engage with this group as we kind of think through it. We have the group has a regular standing meeting, but potentially kind of some subgroups that might be able to inform the process or help us think through things. So I'll send that to Denise and then can pass that along to the group for those who want to continue to be more deeply involved in that project specifically. And then for more community engagement, Joanna can probably cover how we're engaging with all the CalAIM providers in general as well.
Thank you so much, Karis. I see Joanna's on the line. Joanna, I'll hand the mic over to you, but also say thank you for doing the demo last month. I think that it was really helpful and exciting to see, and I'll let you kind of take things from here and sort of share any updates you have.
Sure, thanks, Denise. Yeah, so just a quick update. We have officially soft launched the CalAIM webpage on the 211 website. So you all should have access to that. It no longer requires that password. We did also add a tile to the front of the 211sandiego.org webpage that will just help you navigate to the CalAIM specific webpage a little bit easier. So check that out. We are making a couple more updates today. So if you check the website out on Tuesday, it'll be a little bit different. We are just organizing the content as best as we can. We also did include on the webpage, and I'll link it in the chat here, just a quick guide on how to search for all the different CalAIM resources, either through the website or through our referral database. It's also available on the 211sandiego.org website. So there's a document that's on the website, published in a CalAIM resources section of the webpage that you guys will see. And then there was a question, as Christy mentioned, in the provider work group that several of us attend, in terms of why not all the providers are listed in the matrix, or they're not linked in the community supports table that we have on the webpage. So the reason that we don't have all the providers is just because we haven't been able to actually connect with them and confirm that information. So although we did get, information from the health plans in regards to who they're contracted with, we did take that additional effort to try and reach out to every single one of those providers to just confirm their information, make sure that they want to be listed in our database, that they're able and have the capacity to receive those resources. So if we weren't able to engage with them, we did not list them on the website. If you yourself are a provider and you're seeing that you're not listed on the website, or your resource isn't being linked on the community supports table, do let me know. Reach out to me. There's also on the website, on the main CalAIM webpage, a form that you guys can complete if there's anything that you want to update on the webpage, if you want to update your resource listing, if you want to confirm your target populations that you're serving for your resources. There is a quick form on there as well, and that will get sent over to our team that can, can do something with that information as quickly as possible. So feel free to check out all of those things. You can, of course, email me if there's any questions, concerns, if you want any of the information updated, if something isn't making sense. I've had some providers also reach out and request some meetings, just to, to be able to review the content with either their case managers at their hospital, or different different staff members who may find the website useful. Happy to assist with that. So feel free to reach out if that's something that would be helpful to you or your team. And I think that's it. And I'll just throw in a couple of things in the chat. I'll just throw in the link to the webpage again. I'll throw in the link for that guide on how to search for those resources. And then I'll just throw in my email address, so that if anybody has any questions or wants to get in touch with me, if they want to get in touch with me, they can. Thank you.
Thanks so much, Joanna. We'll include that information in the Slack channel as well, and send it out with our materials from today. I think we have that in the help desk email address you shared with us, Joanna. Very cool. And for those that aren't already aware, I think you all have a conference coming up as well in another week or two. Is registration closed for that?
No,
If-
it's open. We'll add a link if anyone would like to come up. Thank you. Thank
Great.
you, Denise. Yes, we have a summit 7th and 8th of June, in 2 weeks. It's a national conference, but a lot of people from California will be attending and presenting on some of the CalAIM and other topics. So thank you.
Yeah, absolutely. If you send that over too, we can make sure that we share it out with the dates and times along with registration information. All right, we're going to go through a couple of community spotlights, and then we'll go through some funding updates, and we'll get into our activity. So I'm going to hand things over to Anna. So I want to sort of acknowledge May is Mental Health Awareness Month. I know, when we're in the weeds all day, every day, and we don't necessarily think about, outside of our four walls. I don't think that's necessarily true for this group, but it's nice to hear about different things that are happening in the community and with some of the participants. So we'll try and continue to do this in our monthly meetings, just to sort of share out a spotlight on one or two organizations a month. If it's something that you're interested in doing, please let us know. We'll take that in and put it into our event calendar for the year. So just to kind of raise awareness on different things that are happening in the community and organizations that are participating in this collaborative. So with that, I'm going to hand things over to you, Anna.
Perfect. Thank you, Denise. Appreciate that.
Absolutely.
Just to give you guys, my name is Anna Yako. I'm the Associate Marketing Director here at Serene Health. Just to give you guys some insight on Serene, we pride ourselves in using evidence-based approaches in combination with our proprietary software to improve the quality of life for patients who are battling behavioral health and mental health issues. And, mental health is a serious topic now, especially after COVID. We're seeing a lot of patients as early as 5 to 11 coming and seeing for anxiety, depression. So we see all patients from minors all the way to 80 years old. And patients have access to state licensed and accredited psychologists, psychiatrists, marriage and family therapists, and clinical social workers that cover a wide variety of languages. We offer secured and HIPAA compliant telehealth visits as well as in person. We actually have, I have it here. We have over 12 locations currently that serve you, but we're still growing. So it's actually pretty interesting to see how fast we've grown. Right now we have 15,000 patients that we are serving, and it's continuing to grow. And as you know, with the county, it's really hard to get behavioral health services and therapy. So for us to be able to take pride and be like, hey, we can see you right away, with no wait time, we are always excited to say that. And it's great to serve our community, of course, with our quick and easy onboarding process to match patients with preferred therapists. And we accept all types of insurances, including Medi-Cal and Medicare. Our North Park location, and I'll drop a link as well on the chat where you can find our website, fax forms if you have referrals, and the locations that provide in-person therapy. But you don't need to be seen by a PCP or a nurse or anyone to be referred out. It's simply as easy as go on our website and you can send anyone. They can fill out the patient referral form, and I will send that link, of course. And then you can get services. We have a policy within 24 to 48 hours. We have to call you and get you scheduled in with the patient coordinator and be able to assign you to something that's specifically what you're looking for. So, and something I also want to add on to Serene Health is we also take initiative start to mental health awareness campaigns with rural communities that have issues with access and, stigmas that further limit access to the patient's perspective on mental health, what it really is. So we utilize an effective program that continues to allow us in schools of all levels and county programs that further enhance their BH capabilities for providing the resources they need in terms of therapists. And just to give you guys some kind of figures too, Serene's San Diego ECM and CS total figures are ECM is 2,200 and CS is 625. And we are in 28 counties, contracted with 11 MCPs. So we're growing rapidly, and it's been 3 years. And we just love what we do, and we have a great community at where we work at. And people, we're just trying to all together work together to be able to get the services out there to communities, and whatever we can do to help and be able to provide those services. I'm here, Hector's here. I'm not on the call, but we're definitely here to help you guys with whatever you guys need for your guys' patients or community outreaches or whatnot. And I will send the link right now, serenehealth.com. Very easy. Again, all the services are on there. Someone asked, do you provide in-person services? Yes, we do. North Park location. And I will also send a link on where you can find that specific location, the job form as well of where you can fill out the patient. But yes, we, even though we're telehealth, we do have those services where we would allow them to see in person. And that's pretty much it. And we're just growing. We're trying to help everyone. So if you guys need us, definitely give us a call. Let us know. We're always willing and helping to collaborate and see what we can do for the community.
Thank you so much, Anna. I think you have a couple of follow-up questions came up in the chat. Question around mild or moderate.
Yeah,
and
so
why.
it's definitely mild to moderate. Anything that's severe, we would have to outsource out, which we have MedMat management for medicine. We do have other resources, but it is mild to moderate. Yes. From anywhere from PTSD, anxiety, depression. We have family therapists that go from divorce to LGBTQ, specialize in certain types of therapy that a patient is looking out for. So really specialize to the customer or the patient. And it's really important for us to really go in depth and specialize in that. And all our therapists are licensed and able to treat the patient according to what they're looking for.
Thank you so much. Thank you so much, Anna.
No problem.
I'm going to hand things over to Jamie. I see that you're on the line to give us a quick
Yes.
overview of Exodus Recovery.
Yes, sure. Hi, my name is Jamie Clark. I'm the program director for the Exodus, CalAIM, ECM, and CS programs. But we do have a variety of other programs that also entail, mental health services. I think we're most prominently known for our crisis stabilization unit. So it's a 24/7 walk-in clinic for, medications, for mental health assessments, and hospitalization if that's something that's, determined a need. There is also the START program. So that's usually working more so with kids and their families with developmental types of disabilities. There's our AB 109 program. So that works with, the reentry population under the Proposition AB 109. We also have the Project Connect program, and that's reentry for individuals that have intellectual disabilities as well. And then we also have our mobile crisis response team. So it's a non-law enforcement team of clinicians that can act as if, like how PERT would, to meet people in the community to assess them. But people seem to be a lot more receptive to the non-law enforcement presence in those scenarios. So, definitely we have, several locations. I'll put a link in the chat to our San Diego County programs that has, how to reach them, to follow, to look up some further information about them. Something that I can say about May's Mental Health Month is that given that we are, driven by, mental health and passionate about that, we also wanted to make sure that we incorporated that for our staff this month. So it's just been little bits of acknowledgement, validation. It could be, like an email about a mindfulness activity on a Monday, or a little bit of validation and just a reminder to, invest in self-care, to make sure that you're, taking care of you, to be able to show up the way that we want and need to for our clients. And we've had some group activities, and, just really just, having that conversation be an honest one amongst our staff as well, so that we can, also fill our cups while we fill others.
Jamie, amazing. Thank you so much for sharing. Thank you to the both of you for sharing today.
You're very welcome.
Thank you
Very
so
nice to
much.
be here.
Thank you.
We'll go ahead and keep things moving forward. If you have questions, please put them in the chat. If you need us to connect you with Jamie or Anna for any reason, we can make sure that that happens. Otherwise, you should be able to connect with them in the chat in our Slack channel, and you all are on the meeting invite. So all of that information is super transparent. I'm going to hand things over to Lisa for funding updates. I'm going to skip over my slides around funding updates. They were just meant as a reminder for cited the deadline's fast approaching of 5/31 and a couple of other funding things. We'll share this deck with you as we would always, so you'll have that information in follow-up as well. So with that, I'll hand things over to Lisa, and then we'll get started with our activity for today.
Great. Hi, everybody. It's so great to be back with all of you. I'm here to share more information about round 2 for the incentive payment program. Thank you, many of you who have participated in this past week's training webinar for round 2 IPP. We're really excited about this round because we know this is important funding for a lot of providers as you're building your capacity on the ground. Many of you have added new, either new populations of focus or new service lines. And so the plans are opening up the next round of IPP for everybody, so that you all have this opportunity to build your capacity. Denise, would it be possible for me to share screen for just a few minutes?
You should be able to right now. So let me know if you can't.
Thank you. see if I can.
Oh, let me stop my share first though, because I'm a host.
Perfect. Thank you. I think that should do it. So just wanted to make sure that everybody knows some of the key timelines. The application was released May 15th. Our submission portal is opening next week, June 1st. And so this is the second round of IPP funding. And I want to cover the grant period, which is it'll go back to January 1st of this year. And providers who receive round 2 funds will be able to spend these funds retroactive back to this past January, all the way through next June. We're recognizing that there are providers who joined, particularly new providers that joined this past January that have not had an opportunity to apply for IPP funds, which is one of the reasons why we're making the grant period retroactive back to January 1. And we anticipate that by the time you guys get funding, it'll probably be closer to like August or September. And so the providers who are awarded these funds will need some time to meet milestones and to build capacity. So that's why the time period goes through next June 30th, 2024. Wanted to also talk about what investment areas are key. Many of you will be familiar with the investment areas. There are 4 funding areas. The first area, at which many of you will remember, is infrastructure. So if you need funding to support building out your capabilities to become interoperable, connect to a health information exchange, or if you need a closed loop referral platform, a billing platform, there is a funding area. 1 would be your funding area to request funding for that. Funding area 2 is about building capacity for ECM providers. Again, in this funding area, you can ask for funds to build your staffing capacity, training, to support hiring. And we also replicated funding area 3 to do the same thing for community supports providers. So ECM providers who are seeking funding to build your ECM service capacity, you'd apply under funding area 2. For CS providers looking to do the same thing to build out your community support service capacity, you would apply under funding area 3. And finally, there is a 4th funding area, and this is for organizations who are seeking to do quality improvement work. And under this funding area, I want to share some exciting developments with the group. The San Diego plans have decided to include in funding area 4 the ability for organizations who are trying to build community health worker, CHW capacity. You can apply for funding to support that capacity building for community health workers in funding area 4. You can also request funding to build your doula capacity as well. There's recently DHCS added a doula benefit. And so we know that there are some providers who need some additional support to build out their capacity to provide doula services. Funding area 4 would allow you to do that. And finally, in funding area 4, there is a new category to support transitions of care. And so if you are seeking to build some additional capacity to support your ability to provide transitions of care to patients, as particularly as they're transitioning from higher level facilities to step down facilities or back into community settings, there is a funding opportunity under funding area 4. So we wanted to flag that for everyone. Applications are due online by June 15th. And so there's a little bit of some additional time, hopefully for those who are, also applying for Path Cited. This gives you a little bit of extra time to apply. If you run into any issues, challenges, questions at all, we have a team that is ready to support any questions that you have. And so what I'm going to be doing is I will drop into the chat our contact information. It's the San Diego CalAIM Roundtable inbox. We are still checking that on a regular basis. And that is an email where you can reach out to the Transform Health team. We can provide any technical assistance, supports, answer any questions that you need as you're developing your application or as you're submitting it online through the application portal. We will be sending unique links to anyone who has registered and participated in a training webinar or have watched the recording. And so, let me see if that information, let me pause this here and see if I have that information handy. Oh,
If for whatever reason you don't, oh, here we go.
there we go. So, our we've made some changes to our application portal. We've learned a lot from round one, and especially hearing, what some of the challenges were for providers. In round one, we have actually done a round of changes to the application portal to make it easier for providers to submit changes. This is one of the reasons why it's so important for you to attend either the training or watch the training video, because whoever has done that, we're going to send you a unique application link. That link is for your organization. And if you ever need to update the application, you can go straight back to that link and make updates. One of the key pain points from last time was providers couldn't save their applications and come back to it. This unique link will allow you to do that, so you can come back to the application, and throughout the year, it'll also be a way for us to engage with you if there needs to be updates to milestones and things like that. So do not be shy about reaching out to us. We definitely want to make sure any organization who is interested in participating in the IPP program have an opportunity to do so. So we want to make sure that we are capturing the universe of interested applicants, and that we are getting you all your unique links so that we have an ability to support any future edits changes. Let's see. I think I don't need to go over some of this stuff. I do want to share that plans will be prioritizing providers who specialize in serving diverse and underserved populations, as well as housing-related providers who are seeking to address racial disparities. As always, applicants to be eligible need to meet these criteria. So if we're really looking for organizations who either haven't received round one funding, or if you participated in round one but you've added additional services, additional populations of focus, we definitely welcome those providers to apply, knowing that this has been a challenging bill for many providers, and we want to continue to support providers who are seeking to build this capacity. But we also want to make sure that everybody has an opportunity to receive some of these funds. So I'll stop sharing my screen here, and what I'll do is I'm going to be popping. Oh, thank you. So our team has already popped in the link for signing up for the next webinar. The next webinar is May 30th. And so please, it's next week. So please do register for that. Feel free to share these links, this information broadly with your colleagues, with other organizations. And if you cannot attend the webinar and you want to apply, Sarah's also submitted the link to the recording in the chat. We can also post it in the Slack channel for everybody. And as always, please do not be shy about reaching out to us if you have any questions at all. We're happy to answer them by email or hop on the phone with you and work through anything that will get you over the hump to submit your application. So we're looking forward to talking to all of you.
Thank you so much, Lisa. We'll make sure to include all of that information as well. I'm wondering if you have a PDF of that deck, please share it with us. We'll make sure that we include it in our materials. And then Emily, if you don't mind, can you reshare so that we can get into the activity? I know time is tight. And we will make sure, Lisa, everything that you have shared in the Slack channel or everything that you put in the chat, we'll share in the Slack channel and we'll send it along as well. And you can go right to the next slide and we'll talk a little bit about what we're doing today. We're going to break you out into groups. So these are going to be the same groups as you were in before, the same categories. And we're going to look at that brainstorming document that we started crafting in prior months. And we're going to start to try and bring down prioritization from that document. So as you go into the groups today, and you're looking at the information, what we try to do is take the materials that you put in your notes from previous sessions and add them into or incorporate them into activities or action items. So think about some of the groups that you are either actively engaged in because you are part of a work group or that your organization is maybe leading the charge on. Select one of the 5 categories, and then we're going to ask you to prioritize the top 3 items and spend a little bit of time in the breakout room, in particular, going through priority number 1 and thinking about an action item or activity that might advance that category. So you're going to pick your top 3 priorities when you break out, and at the very least in top 1 priority, think about a next step that might advance that. And if time permits, think about the who in the sign me up, especially if they're a member of your breakout room. If time doesn't permit, we'll reach out separately and we'll try and advance that with each group via email, targeted email. So make sure you include your names of the group members. Emily put through the Slack channel again, the Google Sheet. We're going to be popping in and out of each of the work groups, but if somebody can volunteer to be a scribe, there's a help button if you need us. We're going to be circling back around, like I said, and we're going to give you guys as much time as possible to have this activity at the very least 20-25 minutes. So go ahead and select your room. You'll see that you're you can choose back and forth between participants and rooms. So if you unnest that, you'll see the 5 rooms: document standardization, data standardization and sharing, equitable engagement, and you can choose via that join option which room that you are going to.
And you're choosing down from the Zoom controls on the bottom. And just to be crystal clear, so this is going back to all of the ideas that you all have raised over time and trying to prioritize how to start moving some of those forward.
I'm trying to join one of the rooms, but the little bubble to click on it disappeared.
Okay, what room are you trying to join?
It really doesn't. This is my first time in joining this meeting, so it doesn't matter. I could jump in and.
Okay,
And
we'll
it's-
go ahead and assign you, Joe.
Okay, thank you very much.
Absolutely.
Yeah, sorry, I'm having problems too. Can you say again where we're clicking?
Yep. So down at the bottom, you'll see the breakout rooms. You should have a pop-up come up and you'll click on the rooms.
Got it. Thank you.
Yep, absolutely.
Oh, me too. I cannot find.
That's okay, Agnes. Do you know what room you want to go to?
No, you can assign me anywhere.
Okay, we'll go ahead and auto assign you as well, Agnes.
Hi, it's Roxanne calling, representing Mom's Meals. I'm actually driving while listening to the meeting, so sorry I wasn't able to connect my video. Can you also auto assign me to any room as well?
Yep, we can. Any preference? You've gone ahead and assigned. Thank you, Emily.
Yeah, for the rooms that are lacking lots of people, I just auto assign.
Wonderful. And can you assign Joseph?
Yep, there's 2 Joseph's accounts in here.
Right.
Denise, I'm gonna pop into one.
I was just
Yep.
about to ask you to do that.
And Denise, can you actually start popping in as well?
Yep.
We can figure out the rest of the assigning,
Thank
just
you
so
so
everybody
much.
has the same rules and everything.
Sorry, can someone assign me to a room? I don't know if my name's on there. It's Dr. Garcia Keller.
Yep, what room would you like to go into?
I can't see, I'm sorry, because I'm on my phone, so I can't see which, which.
We have documentation, standardization, data, equitable engagement, community collaboration, or client enrollment.
Client enrollment, please.
Okay. Pascal, Lisa.
Yeah, I'm in the same boat. I am on a phone. Would it be possible to be assigned to community collaboration?
Yeah. Okay. Lindsay, Jessica. 5303518050. Any rooms? Otherwise, I will just assign randomly.
Pause the recording now.
Yep.
Hey, everyone.
Yeah, I rudely shut the door on y'all. I'm sorry.
That's quite all right.
We're under a little bit of a time scrunch.
There's never enough time. As folks are coming back on, what I think we'll do, because we're short on time, I mentioned this in the last breakout room that I was in, that I will follow up with the breakout room attendees and try and keep us moving in the next few weeks via email. So what, for those that are coming back in now, understand that the time we had together was short today. I've popped into a few really good conversations. And we have record of the group attendees. So we'll be working with you all and emailing you all next week, not on Monday. Maybe not on Tuesday, recognizing that you all have a pretty hefty inbox. But probably sometime on Wednesday to keep our conversations going. So we'll send separate emails to each of the breakout rooms with where we were able to leave off and get you all moving to sort of that next step. And then we'll reshare, obviously, with the group in its entirety when we have our coffee chat. And then we're going to carry the conversation forward. We don't have time today to get into the measurement strategy, but we'll send you all a draft via handout Because what we're trying to do are two things. Number one, we're trying to start to create activities, little things that we can do that help us move forward. And then in tandem, we're going to start to try to think about different ways that we can measure what we're doing collectively as a community to achieve our aim. And so we'll talk a little bit more about our measurement strategy next month. And in the meantime, we're going to keep moving forward to different activities. These are different things that we can do. Some people call them tests. Some people call them, if you're a QI person, PDSAs. If you're a human-centered design person, you might call this prototyping. So it has so many different names, but really it just means, what can we do? What's tangible? What's an activity that we can do to see if it gets us closer to where we want to go? And so that's going to be what we're going to be working on over the next few months. So stay tuned for that. Appreciate the time today. I know we don't have enough time to share out, but we'll take this this document, we'll reshare it with everybody. And in our email, we'll list out our top priorities that were identified by groups so that you all see that on the email that we send with the meeting materials. We didn't get to a survey that we wanted to ask you about funding, so we'll incorporate that into our feedback survey as well. We encourage you to take that survey, and we'll try and redo it if participation is low in our coffee chat, upcoming coffee chat as well. I wish you all a wonderful long weekend. I hope that you do something fun that's not work related, and we may ask you what it was when we send you out that email. If folks have time and are interested in regrouping as a breakout group, we'll work through that via email as well, and we'll also offer to take a point on coordinating those efforts. Thank you so much, everybody, for your time today. We really appreciate it. We know it's a lot to commit to an hour and a half. It flies by. So much appreciated. Have a great long weekend. We'll talk to you all soon.